this meeting of the James City County Board of Supervisors to order for purpose of an organizational meeting. Mr. Stevens, call the roll, please.
Ms. Sadler?
Here.
Mr. McGlennon?
Here.
Ms. Larson?
Here.
Mr. Hippel? Here. Mr. Eisenhower?
Here.
All present.
Okay, we're going to go ahead and recess at this point.
Yes.
And we will turn it over to the Service Authority, and we'll come back to ours.
I will call to order this meeting of the James City Service Authority Board of Directors for an organizational meeting. Happy New Year, Mr. Powell.
Happy New Year. Good afternoon.
Could you please call the roll?
Mr. McGlennon.
Here.
Ms. Larson.
Here.
Mr. Hippel.
Here.
Mr. Eisenhower. Here. Ms. Sadler.
Here. So we're going to continue, correct?
Yes, sir.
So I would like to have a motion, please, to appoint the chair for the upcoming year. Mr. Powell. Well, Mr. Powell, are you going to make the motion? After we, thank you. Now, Mr. Powell.
Thank you.
21 year.
Now, Mr. Powell.
Mr. McGlennon.
Aye.
Ms. Larson.
Aye.
Mr. Hippel. Aye. Mr. Eisenhower.
Aye.
Ms. Sadler.
Aye. It's all yours.
I'd like to call for a motion to, and thank you so much for your service, Ms. Sadler, for the last 2 years. Appreciate it very much.
Thank you for filling in as much as you did. past year.
Absolutely.
Thank you.
For a motion to appoint a vice chair for the upcoming year. There are nominations.
Supervisor McGlennon, I'd like to nominate.
Okay, thank you. Mr. Powell, are there any other nominations? Seeing none, Mr. Powell, if you'll call the roll.
Ms. Sadler.
Aye.
Mr. McGlennon.
Aye.
Mr. Hippel.
Aye.
Mr. Eisenhower. Ms. Larson.
Aye. Thank you very much. We need a motion to adopt the meeting resolution. There are two options. Do we want to meet during our business meeting or during our work session? We need to make a decision there.
I'd like to see
JCSA.
option 2 at the 5 o'clock time frame. And that way, if any of the public wants to be able to come out and comment while we're in that meeting, then they could as well comment.
So this would be this would be at the 5 o'clock simultaneous with our regular Board of Supervisors meeting.
Correct.
Second Tuesday of the month.
Yep.
Second Tuesday.
Is that good for you, Mr. Powell?
Oh, absolutely, yes.
Okay, with that, we'll move the, are you moving that motion?
I'd move that as a motion.
Okay, Mr. Powell?
Ms. Sadler.
Aye.
Mr. McGlennon. Mr. Hippel.
Aye.
Mr. Eisenhower.
Aye.
Ms. Larson.
We have nothing on the consent agenda, no public hearings. We have board consideration for a grant award COVID-19 Municipal Utility Relief Program, $315,872,000. Mr. Powell.
The resolution before you appropriates the CARES Act funding that we discussed at your last meeting. The money has in fact been received from the state. So staff recommends approval of the resolution. I guess a couple things I would note about the program. Since we bill jointly with HRSD, it provides us with an opportunity to create a process where the customer only has to fill out one application or to make one phone call and to be able to get their credit for both JCSA, water and sewer, and also their HRSD credit. So we've been working with HRSD to try to come up with a process because that is what would be easiest for the customer. So the process we've come up with that I think is the easiest is we're actually going to transfer our money to HRSD, and we're going to let them administer this program basically for us. They will keep track of the money they spend on JCSA water and sewer credits, and then they will have to refund us the balance if there is a balance at the end of the program. So it's a little bit cumbersome administratively from our side of it, but I think it's the easiest for the customer, and that's what we've really been aiming for. My hope is that this will make it easier for the customer, and we'll be able to reach more customers and assist more customers. I would also note that since we last spoke about this, the CARES Act funding has received an extension. We've been told specific to this program that the funds, the extension will last at least until February 19th and maybe longer. I know we have at least an additional 3 weeks, which again, I hope will allow us to reach more customers and provide some additional assistance. I guess I would just also note that any customer that's 60 days in arrears or more has received a door tag. The door tag tells them the number to call or the website to go to. It also has a barcode that they can actually scan with their phone, so the Those are for folks that are 60 days in arrears or more. We've also sent an email to all customers we have email addresses for, which is about 13,700, and letting them know about the program, and we'll be doing some more outreach over to try. So that's a summary of where we are right now with the status of the program, and again, the resolution appropriates the funds, and staff recommends approval.
Motion for approval?
Mr. Powell, if you'll call the roll.
Sadler?
Aye.
Mr. McGlinnan? Mr. Hippel?
Aye.
Mr. Eisenhower?
Aye.
Ms. Larson?
Aye. Thank you. Are there any board requests and directives?
If I could just make a comment related to the COVID funding that was provided to JCSA and HRSD. City of Newport News Waterworks also received funding, I believe $3.2 million in their case. And since a significant number of Roberts District residents are customers of JCSA, I want to direct them to the fact that there is posted on the Newport News Waterworks site information about how you can apply. I don't know whether you can apply in the same way to both the HRSD and Newport News, but certainly folks who are served by Newport News Waterworks should be eligible for the HRSD funding as well.
That's correct. I don't believe they can do it with just one application, but they are certainly eligible. And actually, I'm glad, Mr. McGlinnan, you mentioned that, because Newport News Waterworks did ask us to include in any of our communication with our customers that if they were a Newport News Waterworks customer, that who they should contact. So that's actually up on our website as well. So the information is on our website about if you're a Newport News Waterworks customer, what you should.
Thank you. Thanks for
How much? Is there a motion to adjourn until 5 p.m.?
Could I just ask if Mr. Powell would just mention on the air the issue with the billing?
Yes.
Oh, yes.
Yeah, yes. So I guess I'm pleased to say the November bills are starting to be received by customers. I believe customers started receiving the November bills on Saturday. So unfortunately, Saturday was January 2nd, and those bills say they're due December 30th. We've put out some communication. We're not going to be charging late fees for November or December. But obviously, it's creating confusion and some frustration among our customers, of which all I can say is I'm sorry. I think the circumstances were beyond control. But again, customers are going to be getting their bills past the due date. So obviously, we're not going to levy a late charge on that. But we're also not going to levy late charges on the next bill, the December bill. Those bills, the December bills, have been received by customers who receive their bill electronically. Those bills should be going out in the mail this week for customers that receive their bill in the mail. That does mean customers are going to get their November bill and the December bill probably within a few days or a week of each other. And it's unfortunate. Again, I think it was out of our control, and we're work with customers as much. Obviously, we're going to get this back on schedule.
All right, so is there a motion to adjourn until January 12th at 5 p.m.?
Motion?
Thank you. Mr. Powell?
Ms. Sadler?
Aye.
Mr. McGlinnan?
Aye.
Mr. Hippel?
Aye.
Mr. Eisenhower?
Aye.
Ms. Larson? Okay, thank you.
Thank you.
Thank you.
Two. Okay, we will resume the Board of Supervisors meeting. We'll do the organizational meeting. I will call, first, before we do that, I want to ask for a motion to amend our agenda to add under board considerations a second award called, resolution called owner applications, which deals with the rezoning issues that we.
So moved.
Okay, we have a motion. Call the roll, please.
Sadler?
Aye.
Mr. McGlinnan?
Aye.
Ms. Larson? Mr. Hippel?
Aye.
Mr. Eisenhower?
Aye.
Motion carries.
Okay. Okay, so that's now on the agenda. I will look for a motion to appoint a chair for the upcoming year.
Mr. Chair, thank you again for your service. And with that, I would like to nominate Mr. Hippel for chair, please.
Have the nominations? Stevens, call the roll, please.
Sadler?
Aye.
Mr. McGlinnan?
Aye.
Ms. Larson?
Aye.
Mr. Hippel? Mr. Eisenhower?
Aye.
Motion carries.
Okay, I will pass the gavel, and in so doing, I want to say thank you to my fellow board members for allowing me the opportunity to serve, not 1 but 2 years. Especially thank you for the opportunity to serve during 2020.
Yes, definitely. You deserve that.
You're so welcome.
We are glad to let you have it. Thank you for all your hard work and service and the job you did as chairman leading this board. Appreciate it very much. And I know all the other board members do as well. Yes, sir. Thank you. All right, now we'll go into vice chair. Do I have a motion on the floor for vice chair?
Mr. Chair, I'd like to nominate Ms. Sadler as vice chair, please.
All right, any other motions or any other nominations? Okay, we'll close that and look for a roll.
Ms. Sadler?
Aye.
Mr. McGlennon?
Aye.
Ms. Larson?
Aye.
Mr. Eisenhower?
Aye.
Mr. Hippel?
Aye.
Motion carries.
All right, welcome aboard.
Thank you, sir. Thank you all.
All right, now we're into a motion to adopt the organizational resolution set for meetings and times associated with the calendar, including any changes in the motion. And can I have a motion for, I'm sure everybody's read it, for our organizational meeting for the upcoming year? The only thing that is not set in stone on this as of right now would be our retreat. And did you want to add anything or talk about the retreat before we
Sure.
go into the calendar?
Thank you. So I will just be reaching out to everyone this week to ask your preference. You know, last year, I believe it was a Saturday morning, so we'll be reaching out to see whether Friday afternoon, Saturday morning, what works, if there's any days that don't work. So I will do that starting tomorrow. Thank you so much.
Thank you. Appreciate you heading that up.
Yep.
And that'll be a,
No, me and a retreat.
that'll be, I do. I can't
Except
wait.
I don't like the word retreat. I'll go forward.
Yeah.
So,
All right.
But anyway.
We're gonna go forward.
okay.
Sounds good. All right. Do I have a motion on the floor for our calendar for the 2021 year?
I'll move the motion with a recognition that we're changing the time of the second meeting of the month, our work session, to 1 PM.
Right.
From 4 PM, right?
Yes, and the only thing that I wanted to comment on that, just, I hope that we'll be flexible so that if we have conflicts, we'll be able to look at that. I just worry with some of the other responsibilities that we have.
Right.
If we need to, hopefully give plenty of notice. But I did talk to Mr. Kinsman today, and he did say that, we just had to put out a notice or we had to change something at our next meeting, so. Yep.
And we can, adjust anything we need to on our calendar as the year goes along, but this just sets it in stone. So, the general public knows, and I think by having the 1 o'clock work session, it's, for the general public, it's going to give us more time to work on items in here that are in the work session environment. And of course, our 5 o'clock meeting will always be for the public to come in and comment and give us their opinions. And they're more than welcome to come to our work session. And we're hoping that it gives us more time to work on items in the county, but also able to work more with staff too while they're here and going through and answering questions of concerns that we may have that sometimes we don't, necessarily get to at a work session. So it's going to give us more time to dig in deeper and get work sessions moving a little further. So, all right, I appreciate it. Do we have a motion? May I have a roll?
I made.
Ms. Sadler?
Aye.
Mr. McGlennon?
Aye.
Ms. Larson?
Aye.
Mr. Eisenhower?
Aye.
Mr. Hippel?
Aye.
Motion carries.
All right, that's moving right along. All right, now our next is the supervisor seats on regional boards and commissions. And normally we go into a closed session. So I would need a motion for a closed session to Virginia State Code 223711-A1 of the Virginia State Code.
So moved.
So moved. All right, we have the roll.
Ms. Sadler?
Aye.
Mr. McGlennon?
Aye.
Ms. Larson?
Aye.
Mr. Eisenhower?
Aye.
Mr. Hippel?
Aye.
Motion carries.
All right, we're in closed session. session and need a certification.
Mr. Chairman, I move to certify that we only spoke about those items we indicated we would speak about.
Thank you, sir. Roll call, please.
Ms. Sadler?
Aye.
Mr. McGlinnan?
Aye.
Ms. Larson?
Aye.
Mr. Eisenhower? Mr. Hippel?
Aye.
Motion carries.
All right, now,
Okay.
if you'll lead us off on
We will,
who's on what commissions?
Make a motion that we approve the following list of supervisor seats for boards and commissions. And the Community Action Agency Board of Directors is still Charlotte West, as is served by, in lieu of a Board of Supervisors to 9/25/2022. The Hampton Roads Military and Federal Facilities Alliance and the Hampton Roads Transportation Accountability Commission will be Mr. Hippel. The Hampton Roads Planning District Commission and Hampton Roads Transportation Planning Organization will be Mr. Eisenhower. The school liaison will be Ms. Larson and Mr. McGlinnan. The AFD committee will be Ms. Sadler. Economic Development Authority will be Ms. Sadler. Jamesburg Tourism Council, Ms. Larson. Community Services Coalition Board of Directors, Barbara Watson, serves until January 1st of '23. The Greater Peninsula Workforce Board is Mr. McGlinnan. Virginia Peninsula Regional Jail Authority is Ms. Larson.
Ms. Sadler.
I'm sorry, Ms. Sadler. Here we go. The Historic Virginia Land Conservancy is Mr. McGlinnan. The Greater Williamsburg Business Council is Mr. Eisenhower. The High Growth Coalition is Mr. McGlinnan, and the Williamsburg Area Medical Assistance Corporation is
Larson.
Larson. I think I got them all.
You did. Thank you very much. And do we need we don't need a vote on that. We're just doing our recommendations. You made a motion though, didn't you? You made a motion. Let's go ahead and roll call.
Ms. Sadler?
Aye.
Mr. McGlinnan?
Aye.
Ms. Larson?
Aye.
Mr. Eisenhower? Mr. Hippel?
Aye.
Motion carries.
All right, next are our seating arrangements, and of course, mine will move down further, and then the last will be the number 2 to 5. So I'll be next to the county administrator, and we'll draw seats to
Hope I get
see
my
where
good
everybody's.
Reverse order.
I don't know. If I ever find one, I'll let you know.
One starting
And I
here,
get the last straw.
and 5 goes down to there.
Stay where I
Oh,
am.
you stay where you are. Oh, you stay where
Stay
you
where you are.
2.
are. I knew you'd come down to me. I knew it.
I can reach it better that way.
That's right.
5,
I'll pass you this if you need to.
John's 2, 3,
4.
4.
Interesting. Right.
All right, thank y'all very much on that. That moves us into board considerations and grant award for the COVID-19 Municipal Utility Relief Program in the sum of $315,872. Ms. Day.
Good evening.
Good evening.
As you heard earlier this afternoon, James City Service Authority has been awarded $315,872 of federal CARES Act funds as part of the COVID-19 Municipal Utility Relief Program. The funds will be used to provide economic relief to eligible utility customers experiencing a financial hardship due to the COVID-19 pandemic. The program requires the municipal utility to partner with a county or city to act as the fiscal agent to receive those funds. On December 8th, 2020, the Board of Supervisors authorized the county to participate in the relief program to serve as James City County Service Authority's fiscal agent for this program. The county will receive the funds from the Department of Accounts and pass through the allocation to the James City Service Authority to implement the program along with HRSD. Any unused portion of the funds will be remitted back to the Department of Accounts by the county, and the James City Service Authority will return the unspent funds to the county with sufficient time to comply with this requirement. Staff recommends adoption of the attached resolution to appropriate the funds to the county's Special Projects Grants Fund.
Any questions? No questions? All right, may I have a motion?
So moved.
All right, roll call, please, sir.
Ms. Sadler?
Aye.
Mr. Eisenhower?
Aye.
Ms. Larson?
Aye.
Mr. McGlinnan?
Aye.
Mr. Hippel?
Aye.
Motion carries.
Thank you. All right, next, number 2 is our resolution for owner applications. And do you want to lead that off?
Sure. This was a resolution that has been put together at the request of the board members by the county attorney, with the comprehensive plan being underway and being 2021, the sort of the home stretch to get this accomplished and get the comprehensive plan adopted by hopefully before the end of the year. This resolution basically states our desire to not take under active consideration new land zoning cases until such time as we have had an opportunity to refresh the comprehensive plan, since that's the document by which we are closely guided in making land use decisions. It provides that anything that is currently has an application in will still be heard, and that we have the opportunity to hear on government properties that are seeking rezoning. But the rest would be basically just held in abeyance until such time as the comprehensive plan was completed.
Thank you. And this is basically what I'm reading and what we're asking for is, let's get the comp plan finished and completed, and then go from there. And that way we would have a working document to go on to continue to basically follow what the citizens are looking for in their community and where they want to go. Is that correct, everybody? Okay. Any questions? Yes, ma'am.
Yes, I was going to ask Mr. Kinsman has this been done in the past? Last consideration of the comp plan?
I don't know,
Okay,
Ms. Larson, I'm sorry, I don't know. I know it's been done in the past in other localities.
okay,
It's within the board's purview to not calendar any of these for a year.
Okay.
And you're just sort of announcing that which you already have the right to do.
Okay.
But I don't know if that's something we've done in the past.
okay, thank you.
I don't remember ever having.
Any other questions or comments? Okay. May I have a motion?
So moved.
So moved. Mr. Stevens, roll call.
Ms. Sadler,
Aye.
Mr. Eisenhower,
Aye.
Ms. Larson,
Aye.
Mr. McGlinnan,
Aye.
Mr. Hippel.
Aye.
Motion carries.
Okay. Already finished with our closed session, taking care of that. Okay, look for board requests and directives. Anything?
Okay, I'd just like to wish everyone a happy new year. It's been, I'm glad to see 2020 gone. We're starting fresh, so I think everybody's trying to get their sea legs together here. And I would just, again, like to take the opportunity to thank all of you all and our staff for keeping us level and moving things ahead. So I'm looking forward to a great 2020.
I have a couple of things that I'll bring up at our regular meeting. I would just right now like to wish everybody a Happy New Year and say that part of that Happy New Year will be getting a much better sense of the rollout of vaccinations that address COVID-19. Larson, the board members have raised this well, and we just need to make sure those vaccines don't sit on shelves but get into arms as quickly as possible.
And I'll grab onto that. Thank you for that. And all the board members have been asking the same thing. So Chief Ash is here, and after we finish this section, then I'll ask Chief Ash to come up and just let us know where we're at this point, and maybe answer some questions, give y'all opportunity to say, you know, what's going on, how are we looking, how are we tracking, and let the citizens know that this board is very concerned of this rollout and what we're doing and how we're trying to do everything we can within our power to get this moving as quickly as possible. And he'll comment on a little bit, but thanks for bringing that up, John.
If I could tap onto that as well, I did contact Delegate Batten's office today. They're receiving lots of phone calls and emails about it as well. She's going to keep us apprised of any further updates that we might be getting. And I did get an email that I forwarded to you all from Congressman Whitman's office with some VDH updated info. It's probably the same thing that Chief Ash will probably be sharing, but just to want to let everyone know that we're reaching out to every source that we can to make sure that we have all the information available and so that we can stay as you said, on top of this to make sure we have everything out there for our citizens.
Thank you. And
Sorry,
yeah,
Ms.
that helps.
Larson.
Anybody knows anybody. It's a great time to reach out to them, and so we can get all the information we can to our citizens and let them know that these 5 board members and our staff are working very hard to try to get this taken care of and move through our community. Yes, ma'am?
Thank you. Thank you so much, and I appreciate you having Chief Ash here. I did want to wish everyone a Happy New Year. Congratulations to Mr. Hippel and Ms. Sadler and Vice Chair JCSA. We're going to serve
And
well,
you as
John.
chair.
Woo! And just a little bit of a sad note in that over the holiday, Dan Barner passed away, and Dan was a longtime athletic director at Lafayette, and I worked with him a lot when I was on the school board because he was a big supporter of high school students, high school athletes, coaches, and he had retired from WJCC, but he really served this community well. And I think the Lafayette is really feeling his loss, as you can imagine. And it's even tougher because everybody can't be together. So my sympathies to his family and to his Ram family as well. Thank you.
Sir.
Everybody have a happy new year. Look like maybe we'll get headed in the right direction this year. I sure hope so. I'm waiting to find out what category I'm in for when I get my vaccine. That's a very burning question for a lot of our constituents. I've been getting a lot. Of a problematic year.
Thank you. Thank you very much for all your efforts and time. And a lot of citizens don't realize how much time is put into it from all the board members. And I wish everybody a happy new year. And I think we're going to have a great year this coming year. I think every year is a great year. Every year you're alive is a great year. And, if you grab it like that and take it by the horns, you can manage it. So I'm just happy and proud to be on this board and serving with these great men and women and the staff. Thank you for all y'all have done this past year, and can't wait to accomplish even more this coming year. So, all right, at that, I'll ask if Chief Ash can come forward. He said he'll only be about 2.5 hours. So. All the TVs flicked off. The 3 of them that were watching us. Thank you, Chief.
Good afternoon. Mr. Stevens asked me to come to just kind of provide a little bit of an update on where we are with vaccinations. So first of all, in Virginia, there's a website. I'm sure most of you have taken a look at that. And Virginia's received about 400,000 doses of vaccine here in Virginia. What I don't have is the exact distribution of how that is spread out across Virginia. In our area, the Peninsula Health District has received vaccinations, and they have started to administer those to Group 1A healthcare workers. Specifically, this week, they've been working with the City of Hampton Fire Department, taking care of the EMS providers there. And Riverside Health Systems has worked with the Peninsula Health District to take care of the other fire departments here on the peninsula. So James City County firefighters started this morning about 7 a.m., scheduling appointments for us this week, and a number of our folks have been able to go to Doctors Hospital here in Williamsburg today and receive their first dose of the COVID. Across the peninsula, some others have already taken advantage. Previously, Health Department is really focused on working through that 1A group, which is all of the healthcare providers and also the long-term care facilities. So we have a number of assisted living and nursing home facilities here in the county. Through the Centers for Medicaid Services, or CMS, you'll commonly hear it referred to, they have partnered with CVS and Walgreens, some of the commercial pharmacies, to work through that process to where they'll be able to receive that vaccination directly at their facility and administer it to their residents and staff. We check in weekly through our social services department and emergency management, check with our long-term care facilities weekly. And as of the checkup today, they had not started to administer them, but they had hoped to receive that here in the next few weeks, that they would start that process at our facilities here. In the peninsula area is about 26,000 healthcare workers not associated with the healthcare system that the health department's really focused on trying to take care of that 26,000, whoever wants to receive the vaccine gets theirs first as being part of the 1A. And we'll be looking to, the health district will be looking to move into the 1B, which is the frontline essential workers and those age 75 and older, and to make sure we work through that process. So we have not moved into 1B yet because they haven't completed 1A. When Mr. Stevens and I were talking today, it kind of reminds me back a few months ago when back in the spring we were talking about COVID testing, and lots of people wanted a COVID test, but we hadn't reached the point where the availability yet allowed widespread COVID testing, and we saw that ramp up over a few months. I think we're kind of there in the same point with vaccinations, really hitting that tier 1 group, the group 1A, and focused on getting those complete so we can move into the other levels. The health department has told us that in the next few weeks, they believe we'll transition into that 1B and start to take care of the essential. Those are firefighters that may not be EMS providers that haven't already been vaccinated, police officers, our 911 dispatchers, other essential government, county staff, essential workers at other facilities. There's some CDC guidelines out there you've probably had an opportunity to look at that defines what the CDC believes is in that essential worker group. And then also there's some other essential workers in the 1C group. Virginia hopes to, we hope by the end of this week, maybe the first of next week, to have Virginia's interpretation of what the 1B and 1C workers will be. That'll help for some of the businesses in our community that have some questions about, are they essential services, are they not, and where do they fall in the 1B, 1C, or are they after the 1C? We hope for that later this week or first of next week we'll have some of that from the Virginia Department of Health. Their board who's working through the vaccination process is putting definitions to all those, and we will hope. I anticipate when we get to the group that are age 64, 65 to 74, or those who are 16 to 64 but have a pre-existing condition, the health department believes by that point the third vaccine from AstraZeneca will be available, and that will really help ramp up some of the production and the doses that are available out there. We're also hoping that by that point they'll have some of the commercially available, so you'll be able to go to your CVS and Walgreens and other commercial pharmacies to receive that, and hopefully that will really help start to distribute the vaccine in a way that we're able to work through the 1B, the 1Cs, and the next levels much faster than we've been working through the 1. I really don't have any concrete timelines. I'd like to tell you that this is the exact schedule and we could post that information. We've really been struggling to kind of what's the available doses that are out there, what's the staffing needs that it takes to do that. The Peninsula Health District intends to open 4 vaccination clinics, one in the city of Hampton, one in Newport News, one here in James City County. They'll serve Williamsburg and Upper York County as well, and then one in the Lower York County area. At this point, they believe the Williamsburg facility will be the 3rd one opened in line, and they're waiting to onboard some staff and get everybody up to. It's not just the training on sticking the needle. You know, for a lot of us that have been in EMS care, that's the easy part. It's working through the specific about the medications, what are the side effects, how to administer the drug. So working through all that for those trainings so we can really ramp up and get those clinics open. Folks have asked, I know you've received many questions, Mr. Stevens received a number of questions of how do I sign up for an appointment? Today, unfortunately, there's not a way to sign up for that appointment yet. I certainly would encourage citizens to reach out to their doctor's offices if they are in those high-risk groups. My guess is that the doctor's offices will receive that information probably around the same time we will, and it might be an opportunity where they can get that right through their healthcare provider and maybe not wait for the health department. But we just don't have all those exact answers. We believe that the health department has indicated that they'll have a registration system where folks will be able to go online, sign up, schedule an appointment. Takes about 15-20 minutes to go through the check-in process, receive the vaccine, and there's a 15-minute wait-in period to make sure you don't have a reaction. So about 20 minutes or so to get that vaccine done. They'll be able to sign up for those appointments in advance at one of those 4 clinics once everything's up. It's probably frustrating for a lot of folks, and there's more questions than there are answers, and we've certainly felt some of that ourselves. But there is some light at the end of the tunnel that vaccines are starting to roll out, and it was a good feeling today to see some of our folks have a chance to go and be vaccinated. So that's a kind of a real quick summary, but I'll certainly take any specific questions you have.
Yes, Ryan, if I might, what's the length of time between the first dose and the second dose?
Right, so it depends on which one. The Pfizer vaccine is 21 days for the second dose. The Moderna vaccine is 28 days for the second dose.
Okay. And the AstraZeneca one, is that one just refrigerated, not the deep freeze like Pfizer's?
I don't know that specifically. I'll research that and get back to you.
Okay.
I know it's been released in Europe, and we're expecting that the FDA will approve that here in the U.S.
And then my final question, if I could, so if it gets to the point where citizens can go to their CVS to get their first dose, how are they going to keep track of when you get your second dose? Do they recommend you go to the same place? How does that work?
So we'll have to work through some of those questions with the specific commercial pharmacies. However, today, I was vaccinated today, and when I received the vaccination, the first dose, we received a card from the CDC that has the vaccine information, and while I was on site at Riverside, they went ahead and scheduled our follow-up appointment. The vaccine I had was the 21-day Pfizer, and I don't believe that process would be any different for if it's a CVS or a Walgreens. The health department has indicated to us that you may go to Hampton because it's where you could get an appointment, and then the next appointment be available 21 or 28 days later in Williamsburg, and that would be okay. You don't necessarily have to go back to the same location. The important thing is to get the same vaccine so that you're getting the correct second dose. As far as those commercially available pharmacies like CVS and Walgreens, I'm not sure if they're going to want you to come back or not. I don't know that information yet.
Okay, thank you.
I guess that brings me to a question, though, because when I got my shingles vaccine, it was a series of 2, but they held on to where I got it, said we're going to hold on to the amount of the second dose because we know you're due in 3 weeks. So when we get a shipment in, we're going to hold aside however many were due for their second dose. And they gave you a certain amount of time that you had to get in there once they informed you that the second dose was there. But if you're able to just go to Hampton you don't have to necessarily return to Riverside Doctors Hospital, how are they going to keep track then that they've got enough to vaccinate everybody?
So I think to answer your question, specific in your vaccine, it was both doses. You received part and they held part.
No.
Okay.
No. Just because I'm old and I've had the shingles vaccinate.
Understand.
No, it was a separate shipment.
Okay.
They were just holding out enough for when the second shipment came in that the people who were due to get the second in the series were able to get their second shot. So they weren't holding out enough. So, but they had that in their count. So pharmacies are used to doing this because they've done it before in other series shots. I don't question the commercial pharmacy. What I'm questioning a little bit is if you can just go anywhere, they're not going to be able to keep count to make sure that everybody's gotten that second.
Within that time
So I
frame,
think,
that window.
Yeah.
I think for the Virginia Department of Health, there's a registration system that they're logging your vaccination in.
Okay.
So I think that's also part of the phased approach. If you, for instance, had all 400,000 doses and you gave all 400,000 out, but within the 21 or 28 days, you couldn't get another 400,000, then you made a mistake, right? You can't give them all out. So I think there is a part of that timing is to make sure that the resupply is occurring in a way that you're getting as many doses out as possible, but you're also making sure that you can provide the second dose based on your resupply that you're expecting.
Yeah, so I guess I'm even more confused as to why they would not want you to return to your original place because they would be
I think
able
the
to.
majority of people will return.
Yeah.
Naturally, you probably go to the place that's closest to your house.
Right.
Or closest to, if it's your healthcare provider. So I don't think you don't necessarily have to go somewhere else, but I think, at least from the health department standpoint, for them, their 4 clinics, because the information was shared, were essentially interchangeable as long as those.
Yeah.
I think the majority of the folks who receive it will go back to the same location or the same provider for their.
I'm not running the Virginia, how I wish I were, but it would seem to me that you would want to encourage people to go back to where they got it because if I go and get my shot here, but then I'm going to decide, I'm down in Hampton shopping, so I'm going to go over there, and then Ms. Sadler lives there, and I've jumped her place in line for the.
We are scheduling an appointment.
Okay.
So they're going to make sure that they're not accepting more appointments than they have vaccine to give out as well. So like I said, today when we received the card, all of our folks today got a follow-up appointment scheduled today.
Okay.
To know where to.
And then I guess my only other, it's not my only other, but I'll wait until the 12th. But I am curious, it does seem to be taking a little longer. I mean, I know that there are other places that are further along in this process than we are. Have they talked about that at all? And I know that we had gotten something that said volunteer, and I heard from a neighbor today who is a retired RN who said the hoops, she very much wanted to volunteer to do this. She's willing to, she gave up because the amount of hoops she had to go through in order to volunteer, all the stuff online was just, it was too cumbersome. So
But I don't know, to speak
that
to
may
what
not
the
be
process.
something you can answer.
Certainly, I'm sure that would be a better question for the health department,
Yeah.
exactly what their own work process. But I know we have been working through memorandum of understanding and also the training. So our EMS providers provide this type of injection on a daily or weekly basis out in the field, different medications on a daily or weekly basis in the field. So the skill itself, we've performed many times. So we have been working through what's the specific training to be able to do that as part of a vaccination clinic, even if that's initially only for fire and EMS staff or eventually for county employees, and working through that process. And there is a number of videos that the CDC recommends and the state encourages to take some online training requirements to get there. And then there's some specific to the drug manufacturer. And I'm sure as a Virginia Department of Health employer volunteer, there's some additional onboarding training that they'd want you to complete before. So when we've talked to the Peninsula Health District, getting enough staff to open all 4 clinics, have some rotation, stay open. Their intentions have been to open these maybe as much as 7 days a week if they can staff that appropriately. And there's been discussions of those clinics remaining open for a year. So they'd be available clinically or commercially available through your healthcare physician. There's other places that the health department clinics intend to stay open a year. Someone who wants to receive a vaccine over the next.
Thank you. I did hear briefly on the news today something about Dr. Fauci did say that he thought we were working towards 1 million vaccinations a day in the not so distant future. So I hope that comes to fruition. Thank you.
I just ask a question about our own employees who are eligible for this, the EMS folks and others. Is there willingness to do the vaccination?
We have. So far, specifically for our providers, we asked a few weeks ago, kind of who wants to take it now, who would like to wait, let some other folks take it first and kind of see how that is, and then maybe who's not interested at all. And we saw a little over 50% say they'd like to take it now. There was another group, I'd say 20 to 25%, who said they are interested in taking it, but they kind of like to see someone else take it first. So I would say since we've been able to schedule those appointments, we've seen some of the additional names start to trickle in of saying they have done the research. Now that the information about the vaccine is widely available, the science behind the mRNA, and really I think that's making people feel more comfortable that it's not a live virus or it's not a attenuated virus, that it's RNA, and that's making people, of course, research the science behind it and what does all of that mean. But I think that's making folks more comfortable, so I think we're going to see that number.
I'd just add that my mother, who's 78 years old, still works full-time in the RN for Riverside Hospital, got hers a few weeks ago and has had very little side effect. She thought possibly a little dizziness one morning, but that's been absolutely it. She's done, and the same with her coworkers too, have done very well. I have a few friends that work in the medical, and they've all done well with hardly any, not a medical endorsement, just saying. And,
Sure.
and so I understand how people feel, because, and I'm not, I do vaccines, I do flu shot, I have done my shingle shot, as I said. But when this was first announced, I said, maybe I'll wait a few. Now I'm like, could you mail it to my home? I'll give it to myself. So
We've
anyway.
stayed in touch with fire departments throughout the area, and then some others have kind of polled across the state to see what others are doing. And most areas they've experienced some slight soreness, much like a flu shot, and very few reactions. But we know that that's a real possibility for some folks. And I think the vaccine is a personal choice, whether you're comfortable doing that or not. So many other vaccines have been out for so long, we sort of know what the long terms of those are, and we don't in this case. But everything I've read about the science seems that it's a very safe process to do so, and I was comfortable taking it.
I've got a couple. I'm hearing, and of course, everybody's hearing everything. And, but the second shot usually leaves people with grogginess or, some aches, not making them sick, but just not feeling 100%. When we do our personnel, and you and I may have already talked about it, we've talked so much trying to figure this thing out, but will we do ours on a leave type of basis when, everybody's getting ready to go on a 3 or 4 day leave in case so the next day they're not coming in, groggy and, I don't know if I feel good to keep our staff level up.
Sure. So we've asked folks to do that on a day that they are not scheduled to work, especially on a day they're not scheduled to work. That also leads to one of the breaks that's built into their schedule. Our 3-week rotation has some built-in breaks that are more than a day.
Right.
So if you were one of those folks that has one of the side effects of a fever for 12 to 24 hours or some of the other things we've heard, we're not trying to debate, do you have COVID or do you have a fever from the vaccine, and what effects that has on staffing. So we've asked folks to do that off duty so that they have that break period to work through that. Found is depending on which vaccine you get, the 21-day happens to work out perfect. Our work cycle is 3 weeks, so the 21-day vaccine falls right in the 3-week cycle, and that works great. The 28-day makes that a little bit more challenging in the availability of appointments. So we've asked folks to try to do that. If they can't, because from what we've heard across the state is the reactions have been very mild. We don't believe it's going to have a big effect on staffing, but we have been aware of that and tried to factor that into the rotation. At this point, we want to make sure that everyone who wants the vaccine is getting the first dose and gets the second dose in the right time frame.
Okay, and I figured you had already planned for that. I just wanted to kind of get that out for the general public to know that, we're just not going about it any kind of way. We're planning things out, and we're actually trying to do everything we can to, to move this in a safe manner. We talked about the larger medical systems and all that may be able to get it a little quicker too, and they may be able to spread it out some. We're talking several months down the road, but that might be something the board may be interested in, that some of the bigger medical facilities in our area may be able to help out with some of the shots or not the shots, but what's the proper word?
Vaccination.
Vaccination, thank you. My wife's probably sitting at home going, she knows better than I.
I think you've seen that with COVID testing. Some of those healthcare facilities have offered the drive-in testing locations, and I think, I don't want to speak for them, but I would expect you'd see that same sort of community engagement. Have enough vaccine to make sure they're taking care of their folks and their patients, but then also being able to open that up.
And then my last one is probably the having to be kept in a cold box and where they have like 6 hours or something that, to move, and, so there's not much probably I would think that they can move very far unless they know exact numbers. We're doing 500. We can move that over, and we've got to do it within a 6-hour period or, in order to not lose the effectiveness of the vaccination.
So the Pfizer vaccine has to stay, I believe they call it an ultra-cold freezer. So it's a much lower temperature. As I understand, once you've brought that vaccine out, and I think Moderna's the same, and the time frames is you get it out, some required to mix it, and then some it's ready to go. But it lasts, the hours I keep hearing is 6 hours. That once you've taken it out of the freezer, it's good for about 6 hours. So they really try to schedule those appointments to make sure they're only taking out the vaccine that's necessary for that day, and make sure they don't. I've seen some stuff on the news about some that's been left out and things like that. So I saw today at Riverside, they were looking at appointments and deciding how many to take out, and I'm sure the health department is following a very similar process to make sure that.
Chief, I appreciate you coming out tonight and giving us, we're all getting a lot from, the citizens. Hey, what's happening here? I'm reading this and I'm looking at that, and I'm just basically wanted to make sure the board had all the information we have, and that this is something that we've been working on, from the start of this, anticipating the rollout, and James City County has been ahead of that and figuring out what are we going to do, how are we going to roll this out, what do we need to do, but we're handcuffed by a lot of different unknowns that we don't control as far as staff and what you're doing. But I appreciate all your hard work. I know you're on the team there to keep this moving and keep it going forward for us.
I mean, vaccination is obviously something we talked about when the Peninsula COVID Operations Center opened up back in March. We began to talk about what's vaccine. We were worried about the now, and then we started talking about the future and what does vaccines look like. So it's been a topic for many, many months. And here for the last 2 or 3 months, we've been doing a weekly call about vaccines, and that's fire department, health department staff, and our local EMS council really still participate in those each week. And
Thank you, Chief. Anything else for the chief? Thank you, Chief. Keep up the good work. Appreciate it. All right. Before we go to adjournment, have anything to add to our?
Yes, sir, congratulations, and appreciate you moving us along.
All right, thank you. All right, next would be a motion for adjournment to a 5 PM on January 12th, 2021 for our regular meeting. Do I have a motion? So moved. Mr.
Sadler?
Aye.
Mr. Eisenhower?
Aye.
Ms. Larson?
Aye.
Mr. McGlinnan?
Aye.
Mr. Hippel?
Aye. Thank y'all.